Hello, today we're going to be talking about individual therapy. The first one we're going to talk about is motivational interviewing. Motivational interviewing helps an individual work toward recovery. There are four processes used in this method for motivational interviewing, which are engaging, focusing, evoking, and planning. With this type of program, this would be the most effective for an individual that has acknowledged they have a substance use problem, that is willing to work towards recovery, and that is wanting to continue on with sobriety. And continuing on with sobriety would include going to meetings, NA or AA, 12-step meetings. However, this would not be the best treatment for an individual that is court ordered to be at a program. But there are some individuals that are court ordered, and once they start individual treatment, they have acknowledged that they do have a problem with substance use and is continuing individual treatment to work on recovery and then sobriety. The next one is CBT therapy, which is cognitive behavioral therapy. With this therapy, this works on changing your emotions, feelings, and thoughts when you're recounting a traumatic event. The goal is to motivate and change how you look at and deal with a traumatic event. This treatment would be most effective for an individual that has a substance use problem disorder and someone that has a mental health disorder or has had an assessment and that has shown that there are underlying issues or there are signs of depression, anxiety. So this treatment would be best for someone with dual diagnosis. Motivational interviewing is a good individual therapy, but with the four processes for the method, it doesn't really focus on any mental health issues. It really only focuses on substance uses and how to approach it and different ways that you will continue treatment and what is in that particular therapy. The third one we're going to talk about is pharmacology. Pharmacology is an individual that is in a treatment setting for withdrawal symptoms and detoxing off of substance use such as alcohol. Alcohol is very dangerous when you are maintaining detox because it can result in seizures, hallucinations, and other symptoms that can be very dangerous if you're not in a detox facility. Along with an individual detoxing and has withdrawal symptoms, there is also individual therapy. And with the individual therapy in that treatment setting, they will continue to work on what substance use they are withdrawing from and what kind of individual therapy that would fit with the individual. So in a detox setting, such as Neil Dobbins, there is still individual treatment or there is individual treatment as providing medication for the withdrawal symptoms or for mental health issues. There is also group therapy, but the main thing is individual therapy that works one on one with a counselor that has that can focus on the underlying issues and what needs to be addressed, needs to continue on with the recovery, and what coping skills they can they can provide when they're and they can use when they are in a setting that is dealing with an influence of a friend that uses or family issues. So, although there are group settings, group therapy, there is also individual therapy in a detox setting. However, this treatment or individual therapy would not be effective for an individual that does not necessarily need detox from substance use as such as marijuana. With marijuana, typically you don't need to go to a treatment setting for detox. So this would mainly be for someone that is in a detox setting for getting off safe